Have you ever wondered what truths and fictions swirl around the topic of oral sex? Today, we peel back the layers of misunderstanding shrouding this intimate act. It's enveloped in stigma, often whispered about in hushed tones. Yet it's a part of human sexuality that deserves clarity, not confusion. We'll tackle the fables that cloud judgment and the secrecy that fosters them. By fostering open, informed discussions, we can debunk the myths that linger stubbornly in the shadows. With myths out of the way, let's explore the real effects, starting with the short term. Now, focusing on the immediate effects of oral sex, what actually happens right after? When two people engage in oral sex, there's a cascade of physiological responses. The body releases endorphins, those feel-good hormones that surge during pleasurable activities, creating a sense of euphoria and relaxation. This isn't just about pleasure, it's biology doing its intricate dance. However, it's not all about the highs. There are immediate, tangible risks that come into play, particularly concerning the transmission of sexually transmitted infections, or STIs. Viruses and bacteria can be exchanged through bodily fluids and skin-to-skin contact, making oral sex a potential vector for diseases like herpes, gonorrhea, chlamydia, and human papillomavirus, commonly known as HPV. It's crucial to understand that while oral sex is often perceived as a safer alternative to other sexual acts, it still carries risks. The use of protection, such as dental dams or condoms, is essential in mitigating these risks. These barriers act as a shield, preventing the direct exchange of fluids and contact with infected skin or mucosal surfaces. By using protection, individuals can significantly reduce the likelihood of contracting or spreading STIs. Moreover, it's important to consider the psychological impact shortly after the act. Feelings of intimacy and connection may increase, but so can anxiety and concern about health risks if unprotected. While the immediate effects are crucial, the long-term impacts also warrant a closer look. Moving beyond the immediate, what are the long-term effects of oral sex on one's health? Oral sex, while often overlooked in discussions of sexual health, carries its own set of potential long-term consequences that warrant attention. One of the most significant concerns is the transmission of human papillomavirus, or HPV, which can lead to various cancers, including throat and mouth cancers. It's a stark reminder that viruses know no boundaries when it comes to the human body. Another notable risk is oral herpes, caused by the herpes simplex virus. This condition can manifest as cold sores around the mouth and can be transmitted even when sores are not present through asymptomatic shedding of the virus. The recurrence of oral herpes can be a persistent and uncomfortable reminder of the infection, affecting one's quality of life. Beyond viruses, engaging in unprotected oral sex can lead to other health complications. These include various bacterial infections and even the potential for contracting HIV, depending on the presence of cuts or sores in the mouth. It's a compendium of risks that, while preventable, are often underestimated in their severity. However, it's not all dire. The risks associated with oral sex can be significantly mitigated through consistent and safe practices. Use of barriers like condoms and dental dams, regular health checkups, and open communication with partners about sexual health history are all effective strategies to reduce risk and maintain health. Understanding these effects helps in making informed decisions about one's sexual health. Having uncovered both short-term and long-term effects, how can one ensure safety during oral sex? In navigating the intimate waters of oral sex, communication stands as the anchor. It's crucial for partners to discuss their health status, boundaries, and comfort levels. This open line of dialogue not only builds trust, but also ensures that both parties are on the same page, reducing misunderstandings and increasing mutual enjoyment. Now, onto a practical, yet often overlooked protector in the realm of oral sex: barriers. Yes, I'm talking about dental dams and condoms. These aren't just accessories, they are essentials. Dental dams, for instance, act as a barrier between the mouth and genitals, significantly reducing the risk of transmitting infections. Similarly, condoms, when used during oral sex, can prevent the spread of sexually transmitted infections, including HIV, herpes, and gonorrhea. It's a simple step that maintains pleasure while safeguarding health. Regular health checkups are another pillar of safe sexual practices. These visits are a proactive way to stay ahead of any potential health issues. They provide an opportunity for early detection and treatment of STIs, which can often be asymptomatic in their early stages. Education plays a pivotal role too. By promoting comprehensive sexual education, we can demystify myths, reduce stigma, and empower individuals with the knowledge needed to make informed decisions about their sexual health. Remember, knowledge and safety are your best tools in maintaining sexual health. To conclude, let's recap the key points we've covered about the effects of oral sex. Initially, we explored prevalent myths and highlighted how misinformation can influence perceptions. We then dove into the immediate effects, both pleasurable and risky, and discussed the significant long-term consequences, stressing the importance of awareness. Throughout, the emphasis on safe practices shone through as a beacon for maintaining health and well-being. Encourage ongoing education and open dialogues as tools for empowerment. Stay informed, stay safe, and keep the conversation going. Your sexual health matters.